Welcome to Introduction to Study Design. My name is Jan Jensen. I'm an advanced care paramedic and research leader for the EHS system in Nova Scotia and also an academic lecturer with the Dalhousie University Division of EMS. In this module, we are going to gain an overview and appreciation for research study design. So we're going to gain a basic awareness of the differences in the major study designs. We're also going to provide you with a few key questions which should be asked when you're assessing a research article to determine what type of study design was used in the particular study that you're reviewing. This module is meant to give you an overview of research study design. There's certainly lots and lots to learn about research study design. So this will give you some introduction to it and give you some tools to be able to take a look at that methods section of a research article and decipher what exactly was done in a research study. So in terms of the evidence-based practice cycle, we are now a few steps throughout the cycle. You've already formed your PICO question, conducted a literature search and found a few articles which you're interested in, and now assessing the study design is part of critically appraising a study. So we're now in that phase of the evidence-based practice cycle. Normally when you pick up a research article, the information on study design is written explicitly in the methods section of the article. So that's where you can find it. When you're trying to determine what type of study is this that I'm looking at, have your eyes go right to the methods section. Usually a research article also contains an abstract at the beginning, so a shortened version of the article, and that will also contain the methods section. So either look at the methods section in the abstract or the methods section in the full text part of the article, and that's where you can find information very quickly on what type of study design you're looking at. There are a few important key questions you should ask yourself when determining the design of a study. The first one is this study qualitative or quantitative? Was this a study that looked for themes and meanings and to understand a phenomenon? Or was this study more about gathering numbers and determining differences between things or the effect of something? Those are some of the main differences between quantitative and qualitative. So this is your first important question you want to ask yourself. The questions you ask yourself after this depend on whether you have a qualitative or quantitative study. So qualitative studies, just in general, are studies that use observation, interviews, focus groups, and other methods. Their real goal is to understand the meaning of something or to describe something, perhaps something that's new or something that hasn't been explored before, something that hasn't been described very well before. So an example, and this is an example of a research study that we've done in our system in Nova Scotia, is a qualitative study exploring paramedics' perceptions of providing end-of-life care instead of resuscitation. So this was a major change in practice for paramedics in our system, and we wanted to know how that was accepted, what the barriers to it were, what was going well about it. That's the type of question that's difficult to measure in a quantitative way, so a qualitative approach is more appropriate. Quantitative studies, in contrast, are more objective in that they collect numerical data. These are things that can be measured, can be analyzed, can be compared, and this may be what you're more typically used to seeing when you think of a research study. So an example of a quantitative study is the example article we've been using throughout this course, which you can find on the introduction page of the OWL online learning site, and that's the Bernard study looking at therapeutic hypothermia by paramedics in the pre-hospital setting for patients with return of spontaneous circulation. So the quantitative outcome in that study was neurological outcome. So how many patients in the group that received therapeutic hypothermia versus those who did not receive it, what were the numbers like in terms of neurological outcome? Those are numbers that could be compared and statistical analysis could be done. Let's focus now for a moment on qualitative study design, which we can call QUAL for short. So there are a few key questions. Now, if we say that we have a qualitative study in front of us, a few key questions you can ask yourself about the design of a qualitative study. So the first is about how did the researchers collect the data? So you want to have an understanding of when the researchers went into their study, how did they plan on getting qualitative data? Was it by observing people? So for example, did the researcher observe paramedics at work, or did they observe the patient-paramedic interaction? Conducting interviews, so one-on-one interviews or interviews in a focus group session where the researcher would ask participants about their thoughts, perceptions, feelings on something. Qualitative studies can also be done by reviewing documents such as government documents or policies, videos, that type of thing. So there's many, many different ways that qualitative studies can be done, not simply just by doing interviews. The next important question that you need to ask yourself is about the setting and the participants. How were these selected? This is very important in qualitative studies. It's more important to choose and enroll the right participants with the right perspectives or a mix of perspectives than it is to include a large number of participants, which is a key difference to quantitative studies. And finally, you want to pay attention to how the researchers analyze the data. Did they adequately describe some type of analysis that you could understand how they flowed through the collection, through to the analysis, through to the results of their study? And there are several different qualitative analysis methods that you could see written in the literature, including things like content analysis, grounded theory, these types of things. So let's talk first about how the researchers collected their data. So as we mentioned earlier, the purpose of a qualitative study is to explore a topic. You want to ask yourself, did the choice of data collection make sense for the topic that they were exploring, that they were studying? So if the topic is about how paramedics behave in a certain situation, it would be more appropriate for the researchers to observe the paramedics at work or in the patient-paramedic relationship or something like that. However, if the topic is more about paramedics' perceptions or their beliefs about a topic, it may be better to use focus groups instead of observation or instead of looking through documents. If a topic is particularly sensitive and people are unlikely to speak openly in a group setting, or it's inappropriate to observe in the workplace, it may be better to do individual interviews. So these are examples of some of the considerations that researchers take to mind when they're deciding how to collect their data. So when you're looking at a research study that's of a qualitative study, critically think about how they collected their data and if that made sense. Just make sure it wasn't just done because it seems like it was the most convenient way to collect data, but rather if it actually made the most sense for the topic under study. Some qualitative research studies will use various data collection methods, so they may collect using focus groups and observation, and perhaps pair it with some quantitative data, and that's completely appropriate as well. So let's talk about the qualitative design question number 2, which was how were the settings and participants selected? So as opposed to quantitative studies, which generally you try to get the biggest sample size you can, qualitative studies is really much more focused on gaining an in-depth perspective on a particular topic or phenomenon from a small number of participants. Gathering a large sample size is really not a consideration in qualitative studies. So it's important to understand and pick out of the research article that you're reading, how did the researcher describe how they recruited and enrolled participants? Be sure to keep an eye out for if it appears they enrolled participants because they were easy to access, because they were convenient. It's more important for researchers to find the participants who have in-depth knowledge about something or particular experiences, or perhaps select people who have a variety of experiences or perspectives on a topic, which would better inform the research question. And finally, for qualitative, let's talk about the third question, which is how did the researchers analyze the data? So this is when you're looking at the analysis part of the methods, which often is these sections are designated with subheadings such as study design, sample and setting, and now analysis. So you want to detect, did the researchers use some sort of qualitative analysis method to go through their data and come to their results? And they should describe it, what they did in terms of coming to their results. So you will see some terms like content analysis, grounded theory, ethnography written in some of the qualitative studies. So look for some sort of method. It's beyond the scope of this course to go into each of these types of analysis methods. So in particular, what you want to focus on at this point is to detect some type of method used in the research study that you're looking at. In qualitative studies, anchoring your research study and your results and findings to a particular theory is usually quite important, so you will take a look throughout the introduction and also in the discussion section of your papers to see if they did relate back to a particular accepted theory, perhaps they refuted a theory, or perhaps they're working to build a theory on why these findings are important. And often you will find in the analysis section that more than one researcher will conduct the analysis. So you may see that two researchers will go through the data and do the coding, they call it, or the thematic analysis, and then they'll discuss their findings. While this is common, it's not necessary in qualitative research. Sometimes it is just a single researcher who will conduct the analysis themselves. So when you're looking through the results section of your research article, take a look for quotes or specific examples that support the analyzed results. This will often appear in research publications. So you will see there that in this example that we pulled out, thematic network analysis was a main theme, and that one of the codes that the researchers found that related to that theme was called Advanced Paramedic Education and Training. And then you'll see on the bottom that they provided a quote where one of the participants said something that supported that theme. So it would be from the participant's voice that the codes are derived, and then those codes were lumped into particular themes in this research method here. Okay, let's switch gears here now. We've just reviewed how to take a look at study design for qualitative studies. Now we need to take a look at how to review the design of a quantitative study. So like qualitative studies, there are also a few key questions you should ask yourself for quantitative studies. So the first is, when you look at the methods section of your quantitative study, does it have a comparison group? Is there one study group? Perhaps there's two. Potentially there's even 3 study groups where they're comparing different interventions. The next question you want to ask yourself was, did the data get into the study prospectively? So was the data collected specifically for the purpose of the research study? Or retrospectively, as in, did the researchers go back through existing data sources, such as EMS patient care record databases, and pull data from there? And then finally, if your study that you're looking at did have a comparison group, so 2 or more groups, and it was a prospective study, you want to ask yourself if it was randomized. Were the patients entered into one study group or the other randomly? So key question number 1, if the study is quantitative, does it have a comparison group? So often you will see studies that have no comparison group, so just one study, and those are often called descriptive studies, where they'll describe something that happens to a group of patients. In other studies, you'll find that there is a comparison group. So our example, the therapeutic hypothermia study by Bernard, that does have a comparison group. In terms of study design and the quality of a study or the rigor of a study, it usually is considered better to have at least one comparison group, and that way you can determine differences and detect the effect of an intervention compared to only having one group in a study. Question number 2 for quantitative studies. If the study was a quantitative study, how did the data get into the study? Was it collected prospectively or retrospectively? So prospectively is when the intervention occurs after the study begins. So essentially we're talking about, was the data collected in real time for the purpose of the study? So for example, with the therapeutic hypothermia study, this was a clinical trial. So paramedics were trained on therapeutic hypothermia, patients were entered into one group or the other, one group being those who received the intervention, the other group received standard care, and that data was collected prospectively. Likely those paramedics had specific data collection forms that they had to fill out solely for the purpose of the study so that the researchers got exactly the information that they needed. Prospective studies are considered to be fairly rigorous because they are tailored specifically to the research question. Retrospective studies, in contrast, is usually when the data is collected or the patients were treated in the past and now the data is being collected for the study. So in retrospective studies, researchers often will use clinical or administrative databases to find patients that fit their study protocol. An example of this is collecting patient care reports or dispatch data on patients who had received therapeutic hypothermia in our system in the last year. And you still, retrospectively, could have two groups. You could collect on patients from the last year who received therapeutic hypothermia, and you could also collect on patients who did not receive therapeutic hypothermia for whatever reason. Maybe the paramedics weren't trained in it, maybe their ambulances weren't stocked with the proper equipment, whatever. And then you can compare the outcomes of those two groups. So just because a study is retrospective doesn't mean it only has one group. Retrospective studies can have two or more comparison groups. And then our final key question for quantitative studies. If your study was a prospective study and it had more than one group, how did the patients end up in one study group or the other? So for the therapeutic hypothermia example, if a paramedic arrives on scene, works through a resuscitation with a patient in cardiac arrest, gets a return of spontaneous circulation back, how at that point would those paramedics known to induce therapeutic hypothermia, so they'd end up in the treatment group of the study, or not, so they would end up in the comparison group? How did that happen? So normally this happens through some sort of randomization technique. So perhaps the paramedics would receive a message from their communication center saying, you've been randomized to the treatment group. Go ahead and start therapeutic hypothermia. Sometimes in studies, the clinician needs to call into the study phone line. There's a line set up, and then the research coordinator will tell them which group that they've been in. Somehow randomization needs to occur. The key benefit to randomization is neither the researcher nor the clinician, such as the paramedic treating the patient with return of spontaneous circulation, gets to decide which patient goes into which group. This minimizes the risk of bias, and this is why randomization is very important for increasing the rigor of prospective studies that have a comparison group. So for example here is a hypothermia situation, so all patients with return of spontaneous circulation. In this particular study example here, we used a subgroup of those patients. We only wanted adults who had suffered out-of-hospital cardiac arrest with a VF rhythm. Now those patients would have either entered into the induced hypothermia study arm, which is the treatment arm of the study, or they would have been entered into standard care, so not receiving therapeutic hypothermia, just receiving normal temperature, normal care, everything else being the same. And then the outcomes were measured for these patients who ended up in either one of these groups, which in the Bernard study was the neurological outcome. And this is that example article here, the Bernard study. So as mentioned in the first little bit of this presentation, this section on Introduction to Study Design was meant to give you an introduction, some key tips to take a look when you're reading a research article to figure out what is it that I should be looking for. How can I detect what study design this research article is that this study was? So the key points from all of this is that information on study design can be found in the methods section of a research article. So take a look at either the abstract and the methods section there, or in the full text part of the article, look at the methods section there. You may want to look closely to see if there's a study design subheading where you can specifically find out what kind of study design you're looking for. Look for those words, qualitative or quantitative. Look for the words prospective or retrospective, comparison group or not. These types of things will indicate to you what type of study you're looking at. The next thing you want to do is decide, is this study qualitative or quantitative? Because the questions you ask about study design differ depending on if it's a qualitative study or quantitative study. If the study is qualitative, you want to know, how was the data collected? How did the researchers gather the information that they used in their study? How was the study setting and the participants chosen? This is very important in qualitative studies. The perspective of the participants is more important than the number of participants who participate. And finally, do the researchers describe how the data was analyzed in the qualitative research study? They need to adequately explain their methods around analyzing their data. If your study, on the other hand, was a quantitative study, the key questions you want to ask is, did this study have a comparison group? Was there two or more groups in this research study, or was this a single group of patients who were described? Was the data collected prospectively or retrospectively? So was it collected in real time for the purpose of the study, or was it gathered from existing medical or administrative dispatch, for example, records, and then used for the purpose of the study? And if the study was prospective and had a comparison, so 2 or more groups, how did the patients end up in their particular study groups? Were they randomized, or were they entered into those groups by some other way? Those are the 3 important questions for quantitative studies. Thank you very much for paying attention to this module, and the next step now is to complete the quiz.